Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them just like that. Today, we're talking about 4 wall-less bacteria that don't show up on gram staining but can cause some serious problems. Let's start with 4 quick questions. What urease-producing bug is increasingly tested in vitro fertilization and high-risk pregnancies? Which bug causes walking pneumonia and triggers cold agglutinin hemolysis? What fastidious wall-less microbe causes urethritis and pelvic inflammatory disease? Which wall-less microbe can be treated by penicillin? Stay tuned. Before we talk about each bug, here's what they have in common. These microbes lack a peptidoglycan cell wall. That means gram staining doesn't help identify them, and beta-lactam antibiotics like penicillin are ineffective against them. They do have sterile rich membranes and need cholesterol to grow. These unique traits make culturing slow and difficult, with some taking weeks to form visible colonies. In clinical practice, polymerase chain reaction or nucleic acid amplification tests are the standard tools for detection, typically done on swabs or fluids from infected sites. Let's meet them. First up, Mycoplasma pneumoniae, the classic cause of walking pneumonia, where the chest X-ray looks way worse than the patient's symptoms. Pneumoniae spreads through respiratory droplets, especially in schools and dorms. Walking pneumonia is often mild and self-limiting. Most healthy people recover without complications. However, pneumoniae can trigger cold agglutinin hemolysis and Stevens-Johnson syndrome via immune-mediated skin and mucosal injury, particularly in kids. Pneumonia uses P1 adhesin to latch onto respiratory cilia. It also produces hydrogen peroxide, damaging the airway. Pneumonia grows very slowly on special media, where it forms fried egg colonies. Diagnosis is best done with PCR or serology. Treatment includes macrolides or doxycycline. Again, beta-lactams don't work on them. Next is Mycoplasma genitalium, an increasingly important cause of sexually transmitted infections. It was hard to detect until the 1980s because it doesn't grow well in culture. It causes non-gonococcal urethritis, pelvic inflammatory disease, and cervicitis. M. genitalium uses a sticky surface protein called the M. genitalium adhesin to attach to urogenital epithelium, hide from the immune system, and form biofilms that make it hard to treat. PCR is the recommended way to detect this microbe. The first-line treatment is doxycycline, but resistance has been a growing problem. Moxifloxacin may be needed if doxycycline fails. Next, we have Ureaplasma, urealyticum, and parvum. These urease-positive, wall-less bacteria commonly colonize the urogenital tract, especially in women. Most people carry them without symptoms, but they're increasingly linked to pregnancy complications such as chorioamnionitis, an infection of the amniotic sac and chorion, as well as preterm birth and neonatal pneumonia or meningitis. These microbes make urease, which breaks down urea and increases local pH, potentially damaging tissues. Screening for ureaplasma may be done before IVF or during early pregnancy, especially in high-risk cases, as they're linked to infertility, implantation failure, and complications like preterm labor. Ureaplasma species are invisible on gram staining and grow slowly in special media. But again, NAAT or PCR is the test of choice. Treatment often involves doxycycline or azithromycin, depending on the species and whether resistance is suspected or confirmed. Next is Mycoplasma hominis. This one's part of the normal genital flora in many women and is less important clinically. However, it can cause deep pelvic infections like postpartum endometritis, especially after delivery, miscarriage, or procedures involving the uterus. Like the others, M. hominis grows slowly in lab media, resists beta-lactams, and is treated with doxycycline if symptoms occur. Let's go back and answer these questions. What urease-producing bug is increasingly tested in IVF and high-risk pregnancies? Answer: Ureaplasma spp. Which bug causes walking pneumonia and triggers cold agglutinin hemolysis? Answer: M. pneumoniae. What fastidious wall-less microbe causes urethritis and pelvic inflammatory disease? Answer: M. genitalium. What wall-less microbe can be treated by penicillin? Answer: none, as they all lack peptidoglycan walls. Crushed the questions? Far out. If this clip helped you understand wall-less microbes, click like, share, and subscribe. Grab your downloadable summary table in the description. Thanks for watching. Come back for more Med in 5 Fast Facts.